Plainfield Chiropractic. Hello everybody, it's Dr. Smith, Dr. Chris Smith, and then Dr. Mike Smith. The question is today, did you know chiropractors and naturopathic doctors can help treat infants, toddlers, and on top of that too, children? Alright, question I get a lot because not everybody knows and they're not sure exactly what we can do to be able to help. So I'm going to go ahead and address that today. So first off, going ahead and talking about the infant. So the youngest that I've ever treated has been 3 days old, okay? Mom and dad went ahead, they were familiar with chiropractic, and they went ahead and they brought baby in. From there, we went ahead, we did our examination on baby, and we were able to go ahead and, if needed, mobilize. We're not adjusting like we do with an adult by any means, but mobilize to be able to help put segments back where they belong, taking again pressure off the nerve. From there too, so things that we typically see when infants do come in, when we get babies coming in, typically the reason mom and dad usually bring them in is because mom and dad can't sleep, all right? It's nonstop. So what's happening is what? So if there is any type of impingement going on at all, from there, what do we recognize? Baby's irritable. Oh, it's very frustrated. And again, what does that equal to? Mom and dad not getting any sleep. So what has to happen is we need to help, again, take this away from the baby. And also too, some things that can develop is gassiness, bloating. These are some of the other things that we do see with the infants when they go ahead and the ones that come to our office when we go ahead and we do some treatment. Through our treatment, we're able to go ahead and help relieve those symptoms. And in turn, what happens? Mom and dad now can get that sleep. It's not uncommon to have mom and dad sleeping about an hour to 2 hours. If they're lucky, 3 to 4 hours of the baby having some of these symptoms. Gastric reflux, again, like I said, fussiness, irritability, gassiness. And then once we go ahead and we start doing our treatment, within 6 to 8 treatments, we see a huge difference. We're now baby sleeping closer to 5 hours, and then 8 hours, and then all of a sudden baby sleeping consistently around that amount of time. So mom and dad are very happy. Now at the same time, baby needs to eat, so baby's gonna have to get woken up if it's not waking up to go ahead and get eaten or to start eating. But at the same time, again, mom and dad are much happier. Why? Because actually now they can sleep. Moving on from there, some of the things I want to go ahead and touch on is also what do we see when an infant comes in, or again, even seeing it more with a toddler if it's not as obvious when they're infants, is torticollis. So there was a little bit of damage, whether it was when baby was coming through the canal, or again, if the baby's in a certain position when there's a C-section that's done, where the baby's, again, in a position where its neck somehow is, again, tilted to the side. This is typically, I was asked the question just the other day, what is torticollis back? Again, when the baby's head is like so, what happens is there's some pressure that was done to one side of the neck, creating some damage to the nerves at that time. So again, naturally you see the child like this. Now this is, again, me going ahead and really giving you an example of what you don't always see. The baby's head's not always off to the side like so. But what we do see is that there's a mild tilt. So when we go ahead and we hold baby, we were able to go ahead and see, is there a tilt to one side or the other when we go ahead and we hold. And if there is, clearly that needs to be addressed, because if not, so many other issues can develop as they continue to age if it's not caught early. Which then leads me into, all right, we talked about the infants and also a little bit of toddlers. Now going into children, all right, also we have to go ahead, we have to take a look at scoliosis. This is something else that, fortunately, if we address early enough, we can help treat to help prevent anything else going in terms of creating more of an issue as they continue to age. If we're able to catch this before a certain age, we can actually help in regards to getting the body back to where it belongs, so this child can be fully efficient and be able to go ahead and compete in athletics and be able to go ahead and compete at their highest level, rather than being sidelined due to injuries that go ahead and develop as you continue to have scoliotic issues. So again, yes, chiropractors and naturopathic doctors can help treat with, again, like I was saying before, infants, toddlers, and also children. Now Dr. Mike's going to take over, and he's going to tell you exactly everything that he's able to do as well to help with treating all these young individuals.
Yeah, thanks, Dr. Chris. So the first thing that I want to start out talking about was growth curves, because I feel like it's not addressed enough by pediatricians. So those growth curves are those statistically defined normal limits of growth where a pediatrician is measuring head circumference, height, and weight. And those are important measurements for development. But the growth curves, it's important to know that they should just be maintaining that growth curve. So there's certain percentages. There's the 90th percentile, 75th, 50th. And a parent may hear the pediatrician say, your child's at the 25th percentile for weight, and they think that that's low. But as long as your child is maintaining that 25th percentile as they continue to come in for their well child visits, that's normal. And that's often not discussed enough, I think, by pediatricians, and parents get confused. When we start to get concerned about a child's growth is when they drop below 2 growth curves. So let's say that they're at the 50th percentile for weight, and at their next visit they're at the 25th percentile, and then at their second visit they're at the 10th percentile. And now that's when we start to get concerned, and we start to talk about that child needing more caloric intake so that they can increase their growth and development. So just some normals. Weight loss is supposed to happen in that first week of life. About 5 to 10% of the baby's weight's going to come off. But they should regain that weight. They should get back to their normal birth weight at about 7 to 14 days. And then they should be gaining half to 1 ounce every day for the next 3 to 4 months. So some normal values there. The next thing that I wanted to briefly discuss is vaccines. I know this is a hot button topic, so we're not going to get into all of it today. But I did want to mention that when I talk to parents about it, I believe in informed choice. So I sit down with parents and families. We talk about their risk factors for their family. We talk about that particular disease, how severe it is, how prevalent it is. And then the vaccines. We talk about the ingredients that are in it, and the schedules. So all things that we talk about so that the parents can make a decision from a place of knowledge, and not from a place of fear, because that's how we shouldn't be basing our decisions on. We should do it from a place of knowledge. So I believe that lawmakers should not be telling us what we should be injecting or not injecting into our children. That's the job of the physician. So that's the last thing that I'll say about vaccines for today. Now, the one thing that parents are always concerned about when they come in, I talk about at almost every pediatric visit that I have, is supplements. Parents are always concerned, what should my child be on and at what dose? Or they'll come in and they'll be like, is this brand okay, Dr. Mike? Is this dose okay? So that's something that I talk about with every parent when they come with their child. Talking about dosage, just for a moment, we base the dosage that we give based on the child's weight. So common misconception that it's based on age. We always give dosage based on a child's weight. So again, something that I talk with about every parent when they bring their children in is supplementation. And what's appropriate dosage for them and what they should be on. Common conditions that I see, so acutes, we see those ear infections all the time. Colic is another one, like Dr. Chris was talking about. One management tip for colic, easy, simple one that works, is fennel tea, actually. Fennel tea and acidophilus probiotic orally. Consult your local naturopath for dosage recommendations. And then chronic stuff. So I have a patient right now, juvenile rheumatoid arthritis, ADHD, depression, so all those things I see as well. Coming back to the acutes just for a moment, talking about fever, that's another question that I get a lot from parents is, when should I get concerned about a fever? When it comes to infants, so that first 4 weeks of life, child should never have a fever. So if they do, if they have a armpit, axillary fever, that would be 99.4 degrees or above, that child needs to go to the ER and be seen and be worked up. They'll probably get a broad spectrum antibiotic and then be monitored over the next several days. Some pediatricians will say the first 3 months of life there should be no fever, and they'll send straight to the ER. But some pediatricians will do the second and third month, they'll troubleshoot it and manage it themselves. But certainly those first 4 weeks, there should be no fever. So that child, again, above a 99.4 armpit temperature, directly to the ER. When it comes to older children, I typically say that I'm not going to get concerned until about 103.5 to 104. Again, it's important to remember that the fever is not the enemy. That's the body's normal and natural process to fight off infection, is that we increase the body's temperature to fight off that bug that's starting to cause problems. Okay, so that's what should happen. We need to support that normal process. It becomes a concern when it gets too high. So when it starts to get to that 104, then we got to talk about starting to bring down that temperature, because we don't want damage to happen. And we can do that naturally. We can do it with herbs, or we can do it with pharmaceuticals. They work great too. The last thing that I wanted to mention was a bit of a public service announcement. Continue to take your child to their well child exam visits. I know that it's a lot, especially at first. It's that newborn visit, first 3 to 5 days after birth, and it's the first week, second week, fourth week, and then it's every 3 months, once you get to 3 months, all the way up to 2 years. So it's a lot, but it's very important to monitor your child's growth and development. So continue to do it. It's important. And that's what I have for today.
Did you say you had someone you recommend?
Oh, I did, yes. Yeah, thank you for reminding me. Yeah, so we work with, at our office, we work with Dr. Natalie at Whole Child Pediatrics in Yorkville. She is great, and we totally recommend her to anyone. I know she's got a busy practice, so if you're looking for a pediatrician, give her a call.
So again, thank you so much, everybody, for going ahead and listening to us today. Again, if you have any questions at all, or if you have any interest in what Dr. Mike and myself had to go ahead and talk about, please go ahead and PM us. Also, like us, love us, share us. Go ahead and like I said, if you have any questions, just go ahead and fire away. You can PM us and let us know. Have a great rest of your day. Again, thank you so much.